Bennett is the current coordinator of the mental health program at the Ministry of Health. This unit is charged with addressing the mental health needs of Belizeans.
The approach of the Ministry of Health is to make mental health care access, especially at the level of the community. And we have programs that address mental health from prevention to treatment and rehabilitation. So everything is included in that. Our country signed on to some very important conventions. One of them is the Human Rights Convention. And that means that every citizen in Belize then have those rights. And they have those rights, and it didn't say that if they have a mental illness, then those rights will be taken away. It says clearly they are inalienable, and it goes to the dignity of the person.
Earlier this week, the very disturbing image of an adult woman imprisoned in a shack raised much concern from the public. While in the past, mental health patients in Belize were institutionalized in facilities like Seaview and subsequently Rockview, that is no longer the approach to treatment in today's society.
My guess is that there are still many instances where this is still happening. Because we no longer focus on institutionalizing people, people with mental health disorders now live in their communities, so they now live with their families. And we have some programs to support them so that they live a productive life. And so, because we understand now that people with mental health disorders can work, they can take care of their children, I think that has led to people relaxing a little bit and not feeling the need to confine people to a room or not have them come out. As I said, it's still an issue, I think, because many times families feel overwhelmed, they don't know what to do, and in some cases they think that is what they should be doing. That family is a lovely family, and I am sure, and I know they love that girl. But I understood that she must have felt as if she had no choice. But certainly I was very disturbed by seeing her locked in there. That is definitely not what the mental health program advocates or supports. It is important to us that the rights of persons with mental health problems be honored. And we want people to understand that a mental health disorder does not mean certain rights will be taken away from you.
In this particular instance, the young woman was receiving care for her mental illness. But it is not uncommon for persons under treatment to experience periods of crisis. Since this incident came to light, the Ministry of Health has reached out to the family.
We have reached out to the family. Our mobile team went to visit. It's interesting that in many cases people really think that they're doing the right thing. They actually think that they're doing the right thing. Because they might get overwhelmed. Maybe that one caregiver was feeling stressed and really didn't know what to do. But yes, what we determined was that people were ignorant of the rights of other people, and that having a mental illness does not mean that that person's rights should be violated.
All rights, though, come with responsibilities. Bennett took the time to clarify another recent scenario regarding a mentally ill person who committed a crime.
We provide services to the Colby Foundation. We have almost 100 persons in there that have been charged or have a judgment against them that have mental health problems. And so that tells me then that if you have a mental health problem or you commit a crime, you can be charged. What the mental health department does is when somebody is charged, they are brought in, they are taken to the magistrate. If the magistrate noticed that the person has some behaviors that is preventing that person from answering to his charges, he will remand that person to Colby, and then order us to perform a psychiatric evaluation. And he will tell us, we have to do it periodically and tell him if the person is fit or unfit for trial, because in many of the mental illnesses, people have periods where they're very clear and periods when they're sick. And so you can never have a blanket paper because a person might commit a crime when they don't have symptoms, and then they can answer to their charges. Their diagnosis then does not, it's not a factor.
The mental health professional then determines the fitness of the individual to stand trial, and in some cases have to administer court-ordered treatment for persons who are unable to answer to a charge. Belizeans may be more open to the needs of persons with mental illness, but there is an urgent need to look at issues like employment, housing, and family support for these persons. Most importantly, we must educate ourselves on the different mental illnesses and remember that, like any other health issue, diagnosis and treatment is available.
They're basically biological problems that need to be corrected, in many cases with medication. So if you see somebody acting really out of the ordinary, hearing voices, seeing things, families need to get that person for treatment immediately, because these chemical issues are corrected by chemical interventions.
Mental health services can be accessed at all public healthcare facilities countrywide, free of cost.